OpenAI recently shared a statistic. More than 1 million people every week are having emotionally heavy conversations with ChatGPT. Imagine a scenario. It's late at night, someone's struggling emotionally, and they are typing everything into GPT. But most AI chatbots are built on general large language models or LLMs. They are not meant for mental health care. There's a genuine demand for a solid mental health communication system worldwide. If you want this demand to grow without falling apart, AI is not just a necessity, it is inevitable. So, if you are a psychiatrist, a mental health professional, or planning an efficient mental health app, this video is for you. Hey, I'm Anona Banerjee, co-founder of Sunyam Software. I work with founders to turn ideas into real apps. I am not a mental health expert. I come from the technology side. I build the systems and apps people use every day. And that's why I know this. The real difference comes from how you put AI into the system. In this video, I will break down 3 fundamentals we follow when building apps in this space. The first one is choosing the right model. Sometimes I hear this, why not just use the most powerful AI model available? A general AI model is designed to respond to everything. In mental health, that can be risky because the same message can help someone or hurt them depending on their state of mind. And that's why the AI you choose really matters. Now practically you have 2 broad choices. One option is using hosted models like GPT-4 class models or Claude style systems. They are powerful, quick to integrate, and good for early testing. But they come with usage costs, data handling limits, and less control over behavior. The second option is open source models like Llama, Mistral, or similar families. These are more cost effective and you can host them yourself. You can fine tune them in your own way and keep sensitive data inside your system. But remember, with that freedom comes full responsibility, infrastructure, safety, security, all of it's on you. At the end of the day, it's not about picking the most popular model or grabbing the cheapest one. It's about picking a model that fits your tech setup, your budget, and how much risk you are willing to manage. That's what choosing the right model really means. Now the second point, training the model for a clear purpose. Let me share something real with you. One of my clients is building a mental health product and he said this, I want my AI to listen more, speak less, and when it speaks, it should be wise. That line tells you everything. In mental health, training isn't about feeding the AI more data. It's about teaching it when to respond, how to respond, and when not to respond at all. On the tech side, when you are training the AI, there are a few key things you need to keep in mind. First, what kind of help the AI is allowed to give. Next, how it should sound so it feels calm and safe. And when it needs to stop and hand things over to a human. But this part isn't just about tech. Mental health professionals play a key role here. They guide how the AI responds in real situations. Good training doesn't make AI talk more. It makes it behave better. And that's what really matters in this space. Now the final point is deploying the model with security. You probably remember the Vastamo incident in Finland. A mental health clinic's database got hacked and thousands of patient therapy notes were leaked. It caused panic, trust was broken, and people stopped using the service overnight. So security is the most important part that goes without saying. It's a serious issue and there are a few security checkpoints you simply can't skip. First is encryption. All messages should be unreadable to anyone. Even if someone gets access, the data won't make sense. Cloud platforms like AWS, Azure, or Google have built-in ways to handle this really well. Next is access control. Not everyone on your team needs to see everything. You decide who gets access to what, keeping it as minimal as needed. Services like Okta or Auth0 make this easier to manage. Then keeping AI separate from user identity. The AI reads the user's message, not who the user is. Names, emails, and personal details stay inside your backend. So even if the AI layer is exposed, people stay protected. And finally, logging. It's like a behind-the-scenes check on everything the app does. If something unusual happens, you can catch it early. Tools like CloudTrail, Datadog, or Splunk make this manageable. So, if you are building something in the mental health space, keep it simple. Choose the right model, train it with clear boundaries, and deploy it with security from day one. Now, if you have an idea, mental health, or anything else, and you are confused about the tech side, you can reach out to me. We guide founders every step of the way from idea to launch. So if this video helped you, hit the subscribe button. I share tips to help founders build smarter, faster, and better apps. See you in the next video. Bye.